If you're helping a loved one with their medication and you're worried about getting it wrong, you're not alone. I see these mistakes every week, and it's easy to avoid them once you know how. Hi, my name is Portia and I'm the director of Homecare. I've been a nurse since 2018 and a midwife since 2021. I support families every day with some of the biggest decisions around care at home. So before we get into what we will learn, this is a good time to grab a notebook, grab your cup of tea, grab your coffee, sit in a nice quiet environment, and let's see what we can learn together. It's good to give a definition of what a medication error is. Medication error happens when something goes wrong when you are preparing the medication, when you are administering the medication, or even when you're taking the medication. And majority of the time, this is an accident. It's essential that we have guidance, tools and systems to reduce the risk of this. So throughout this session, we'll learn about the common medication mistakes that happen at home, how we can improve that by implementing systems to keep us safe, and also as well what to do if a medication error occurs. So sit back and hopefully you can learn a few things throughout this presentation. When I used to work as a complex clinical lead for a home care agency, the common mistakes I saw when I went into these families' home was carers giving the wrong medication at the wrong time. There was some medication discrepancies where they've given a medication that had been so similar to another medication. And as well, there was a lot of times where I visited their homes and I've seen expired medication. So when I had a new client and you have to review them for the very first time, sometimes there's so many factors that can affect the likelihood of a medication error happening. So we'll look into the most common mistake that happens at home, and that would be administering the wrong medication. What could that look like? That could include administering too much of the medication or even too little of that medication. And one essential tip that I give families to support that is, when you're administering medication, ensure that you're in a quiet environment with no distractions and nobody speaking to you while you're administering that medication. You want to do it in an environment where you can concentrate on what you're doing. So I've given an example here of a medication, amoxicillin. So I would read, this is amoxicillin, the strength is 500 milligrams, and it says take 1 tablet 3 times a day. So you understand what the medication is telling you to do. So on the medication, it will normally tell you give it orally or however the route is. So when you're doing that practical steps, the risk of you administering a medication that is too little or too much, it then becomes reduced. Also, another essential tip is sometimes most family, the medication says 1 spoonful needed. What people do is take a tablespoon or a teaspoon from their kitchen and use that to administer the medication. And a tablespoon and a teaspoon are 2 different size measurements. So if you get your tablespoon and teaspoon, you see that it will look completely different. So which one is the correct dose of giving that medication? Usually when a medication is written like that, what they have is their own specialist tool that comes within the medication. If there's not one there, please ask your GP or pharmacist to dispense one to you so that you are given the accurate dose to your loved one. If at any point you don't know how to administer the medication or how much to give, call your local pharmacies and they can teach you and describe or even come and see you face to face on how to give that medication. So for example, some medication are given via syringe. There's a few calculations that you have to do in terms of giving the right medication. So sometimes it will tell you give 5 mils, give 10 mils. Please ensure that you know how to draw up the medication. And if at any point there's a bit of confusion, please double check before administering that medication. Another common medication mistake is missed doses and timing issues. Typically what families do is, in the worst case scenario, they miss a dose and they want to give another dose straight away. They say the next dose to be a 4-hour gap in between. What's really good is in each medication there is a patient leaflet. It normally looks like a white thick paper in there that tells you about the medication. It tells you about what the medication is for, but then also it gives you instructions of what to do if a medication is missed. Please never double dose. If you're unsure of what to do, even if you read the patient leaflet, contact your GP, contact your pharmacist and explain the situation, explain what medication is due, when's the next dose due, and they can advise you whether to administer the medication or just carry on with the next dose as normal. I do understand that life gets busy, life gets really hard to manage at times, especially when you're caring for your loved one. What would be a really good system to use that you can ask your GP or your pharmacist, especially if you've got a lot of medication prescribed, is to see if you can put the medication in blister packets. So a blister medication is really good at grouping the medication needed and putting them at the allocated time. Normally it looks like a book. At the front of the page it says the medication. It normally gives what the medication looks like, and within each blister packet it allocates a space whether the medication should be given morning, afternoon, evening, and it sorts out what needs to be given, so you know what dose exactly to give, what medication to give, because it's already done for you. And that's really good when you have tablets or capsules. If it's liquid medication, then this wouldn't apply to it. Another good way is medication boxes, where it shows morning, afternoon, or evening doses depending on what you need, and you pre-prepare that medication beforehand, maybe a day before, maybe 2 days before, and slot the medication in the right place and have a timing. So that could be an alarm on your phone, so when it rings you know exactly what medication to give, and that's very good if you're administering that medication yourself. Another helpful tool that is used especially within the home care industry is a lot of home care agencies use medication charts, and that's really essential to keep track of what medication is given, especially if 2 or more people are given medication to your loved one. So by having a medication chart where you got the name of the medication, the timing that is due, and then when you administer that medication you either sign or tick for it, so the next person that is supporting you to administer that medication will look at the chart and say, okay, this medication has been given. I am not going to come in 5 minutes later and give that same medication. Or if you were to go to work and they have the medication chart, they know, okay, you've given that medication this morning, then I know that I can give the next medication in the afternoon. Another common mistake that families make is administering the same medications twice. Put an example here for you to see. They both begin with the same letter. They both have the same dose, they both have the same strength, they both have the same instruction. So it's very hard, especially when you're overwhelmed with a lot of medication boxes. Let's say you've got 20 medications that you need to administer and there's no set routine. Let's say typically you lay it all down on the table. You're not sure what medication you've given. You might give a medication, you put it aside. You might give another medication, you put it aside, and then you realize, hang on, did I take that medication? Did I give that medication? And now you're sitting there because you're not sure. And unfortunately, what ends up happening is some people end up giving the same medication twice. So an essential step I give my family is to check one box at a time. So you have your medication, you review what is due for the allocated time, you take that medication out of the storage or the bag that you keep it in, and then one at a time, you give the medication, you pop it away, you take the next medication, you go for your check, the right medication, I know where to give the route of that medication, I know the strength, it's the right time, you give that medication, you pop it to the side. So then you already know, okay, on this hand, these medications have been given, and on this side, this is the rest of the medication that needs to be given. So you know that you have not given that same medication more than once. Another common medication mistake that I notice is when medication is given by the wrong route. And it's so important that medication is given in the way that it's prescribed, because it can actually create life and death situation. Let me give you a clinical scenario where, let's say that a nurse is working on a ward and the doctor has prescribed a medication that needs to be administered through a feeding tube that goes directly through the stomach. The nurse has forgotten that on the patient's medical history, they're not to be given anything orally because it increases the risk of the medication going down the wrong route and into their lungs, or causing them to choke or cough because they have swallowing concerns. That could be a life and death situation because the nurse hasn't checked how the medication should be administered. So it's very important when you have your box of medication, what does it say? How does the medication need to be given? Is it through orally? Is it through a patch? Is it through eye drops? Is it an inhaler that needs to be inhaled? Is it a nebulizer that you need a nebulizer machine for? So you need to be able to see what your medication is prescribed for and how you give it as well. If you're unsure of how your medication is given, or you want a bit more information around it, what I would recommend is contacting your local pharmacy or your GP and seeing if the GP can come up with a medication list. Also, when they have that medication list written, it states how the medication should be given. Another common medication mistakes that a lot of people actually forget about is expired medication. It's so easy for expired medication to build in your home over time, especially when let's say your GP is sending regular medication posted to your house, maybe every 2 weekly, every monthly, and it gets to a point where you have a lot of medications that is sat in your storage and no one is able to check them. When I was working as a clinical lead and I was visiting my clients in the community, what I would do is go through each medications every month to see if there's any expired medication. And sometimes when it's a brand new case, care package and you're going to see them for the first time and you look through the medication, you can see medication that is backdated to 2018, 2019, 2020. And what I would recommend to family is to have a medication booklet where it has the name of the medication, what is currently in stock, but also what medication is expired, so at least you know these are the medication that I should not be given. To look if a medication expired, what I typically would do would check the expiry date on the actual medication package where there's a box, and also as well if it's a tablet form, normally what it has is a silver film, and at the edge of the silver film it shows the expiry date of that medication. Also as well, if you are administering eye drops, it will tell you instructions say discard after 6 weeks, discard after 4 weeks. So now you've had a look at your current medication and you've spotted a few expired ones. What do? Please do not throw them away in the bin. Please don't flush them away or discard them around the area or outside. What I would recommend is for you to contact your local pharmacy or even just to go there and give them that medication. If it's a situation where you want to ensure that the medication is taken from you, what I would recommend is calling your pharmacy in advance to say, I have expired medication that I would like to drop off at the pharmacy. When will be the best time to do that? And normally they can tell you a time or a day to drop in and do that. If you're not able to visit your local pharmacy, what you can do is either call that pharmacy or your GP to see if they can do a collection date to come and pick the expired medication and take it back to their local pharmacy. The last common medication mistake that I often see families do at home is stopping the medication too early. Your GP might prescribe you a 7-day course of antibiotics. Maybe by day 3, the symptoms have reduced completely, you now feel better within yourself and you decide you want to stop that medication. Or you're on a long-term medication, for example for antidepressants, pain management, and you just want to come off it. Please do not stop your medication too early. A good way to go about it if you want to pause or stop your medication is to discuss that with the GP and the local pharmacist too. They can then set up a safe plan of reducing that medication for you. And typically what it may look like is reducing that dose gradually over the course of the next couple of weeks, over the course of the next couple of months, to make sure that they can safely take you off that medication without any severe side effects. As well, in regards to antibiotics, when an antibiotics is not completed or cut too short, you don't get the full effect of the medication. So for when you safely set up a plan with your GP or your local pharmacist and you've safely weaned yourself with their support of the medication that you are prescribed for, what I would advise you is to monitor any signs or symptoms that you develop during that stage, so that when you go for your next medication review with your GP, you're able to have a note, have a diary of what you felt since coming off that medication. Then they can advise you on the next step, or the plan of completely taking you off has to be reviewed to make sure that you are taken off safely. So now you've got a good grasp of how to lower the risk of medication errors. Let me advise you of what to do if a medication error ever happens. First things I want you to do is please take a step back, take a deep breath and don't panic. Medication errors are more common than often, and it's not because you're not knowledgeable, it's not because you did it on purpose, but these things, it can just happen. Life gets busy, sometimes you get overwhelmed with caring. What is the most essential thing is to recognize what medication you gave and what the error was, so that you can ask for further support. What I would advise initially is for you to have a look at your loved one to see if there's been any reaction, any allergies to the medication. And what I want you to do is to pick up that phone, call 111 and explain the situation, that you've made a medication error, and please explain what the medication error was and what reactions you have seen. And once things have calmed down and you've managed to settle your loved one, have a discussion with them about what happened, what medication was given, it would be good to review how you can ensure to lower the risk of medication errors for next time. Thank you for sticking with me till the end. If you want more support at home, you're welcome to join Homecare school community, where we share guidance, live courses to support you with caring for your loved one at home. You can also download our nurse-led digital tools. And if your loved one needs hands-on support, Homecare provides nurse-led support at home. Don't forget to like, subscribe and drop a comment. I always check them and I love to hear what you want me to cover next. Keep an eye out on the next video, it's coming soon.